Hello, everybody. And as Rachel said, my name is Jessica Hollister, one of the newer docs at Nittany Eye Associates. Originally from Altoona, so not too far away from my hometown. So we're going to talk about dry eye tonight: the good, the bad, and the dry eye. Common solutions for a common disease. So why are we talking about it? Well, there's an estimated 16 million Americans who have been diagnosed with this disease, but the number of Americans suffering from the eye symptoms is likely much higher. Some reports indicate that nearly half of all Americans, especially US adults, experience dry eye signs and symptoms. And about 1/3 of the patients that come into our clinics present with actual complaints of that dry eye. The manufacturer's global revenues for dry eye treatment is expected to be around 6 billion in the year 2023. So it's not, a small disease and the like. And the treatments, the expected expenses, that doesn't include, loss of wages, loss of production, those kinds of things as well. Dry eye is a common and often chronic problem. With each blink of the eyelid, the tears spread across the clear surface of the front of your eye, and that's known as the cornea. So if you can see my arrow, maybe not, there we go. This clear kind of surface window there, that's the cornea. The tears provide the lubrication and nutrients to reduce the risk of eye infection. It washes away foreign matter in the eye, and it also keeps the surface of the eye smooth and clear. With excess tears that then flow into the small ducts towards the inner corners of your eyelids, which then drain into the back of your nose. And dry eye either occurs because of the tear production and drainage are not in balance, or because the quality of those tears are poor. So to go into a little bit about the science of the tear film, microscopically, we have 3 layers to our tears. The first layer, the mucin layer, is the innermost layer. It allows for the middle layer to spread evenly over the surface. It helps the eye to remain moist and lubricated, and it also provides the underlying cornea, that clear window, with nourishment and helps the eyes, helps the tears to stick to the surface of your eyes. The middle layer is the majority of our layer, the majority layer of your tear film. It is the aqueous or water layer of your tears. It lubricates the eye, washes away those foreign particles, and prevents infection. And the third layer is the outermost layer, the lipid or oil layer, that seals the tear film to the surface, helps reduce evaporation. So with those 3 layers of tears, they come from 3 different parts of the anatomy of your eyeball. The oil layer, the outer layer, comes from your meibomian glands. So looking down here at this picture, the glands are hidden in the eyelid. However, the oil is produced here and then expresses out through little glands that I'll show you in a picture soon. That's the outermost layer. The inner layer, the aqueous layer, comes from your lacrimal gland. And that lacrimal gland, I keep losing my mouse and I'm sorry. That lacrimal gland is up here in the upper temporal part of your eyelid, kind of in the fatty part of your eye within your orbit. And then the third part actually comes from your goblet cells, and your goblet cells are actually the top surface of your cornea. So the top surface is producing that mucin layer. The aqueous layer makes up majority of that tear film, and that comes from your lacrimal system. So just to review a little bit about that process, the tears are produced from that lacrimal gland and released down to the surface of your cornea. As you blink, it distributes that tear across the front surface of your eyes. The tears then, drain to the bottom. They follow gravity. And as you blink, it tears down towards the bottom, pulls into what we call the lower lacrimal puncta, into your canal, down the lacrimal duct into your nose. So that's why when you tear, like you're crying, that's why we get a runny nose. So many, many causes for this chronic issue, age being a major factor, gender. Unfortunately, us females are more prone. I think the statistics say up to 70% of us are female. Hormones, environmental exposure. So environment being smoke, whether it be environmental or cigarette smoke, exposure to chemicals, whether it be workplace, again, smoking, even people don't think about it, but you sleep on a pillowcase and you wash that pillowcase with a laundry detergent. Windy and dry climates, extreme heat and cold. A major one, computer use. And that's why we think it's worsening, because we're doing computers 24/7, 365, a ton of it. Some major systemic diseases that contribute, and this list is very limited compared to what, can contribute to dry eye. Rheumatoid arthritis, Sjogren's, lupus, rosacea, diabetes, thyroid. Contact lens wear can increase your cause for dry eye. Limited as far as the medications, that list goes on and on as well, but the main ones, antihistamines, decongestants, blood pressure medications, antidepressants, acne medications, birth control. Also, if you've had a history of corneal surgeries, LASIK, PRK, if you've had cataract removal, any history of trauma. So the typical symptoms you might have if you feel you're experiencing dry eye: burning and stinging, itching, aching sensation. Those eyelids are feeling super heavy. The eyes are feeling really tired. The eyes are just sore. The sandy gritty feeling, you're blinking those eyes and you're feeling like, oh my gosh, this feels like sandpaper. Some people come in to say, my tears, I'm tearing like crazy. And we say, you've got dry eye. It sounds like we're crazy, but actually excessive tearing can be dry eye. Redness, light sensitivity, blurred vision. So what are we looking at as your eye doctor behind that microscope? I've included a few things here. Of course, there are a ton more things, but the main things we're looking at, big ones. The first picture we have here on the left is called punctate keratitis. So the first picture I showed you on that first slide, that clear, smooth window, no dryness, you're gonna have a smooth surface. So what this picture is showing is, I like to demonstrate it as, instead of a clear window, you're looking through a piece of sandpaper. So in this picture, we have put a little bit of stain in, which I'll go over that shortly here, but we've put a little bit of stain in the eye and we've turned our light blue. And so if the eye weren't dry, there would be a little bit of yellow stain just, covering the full surface, but you can kind of see this kind of pitty appearance. So this eye is so dry that instead of being a nice clear surface, it is so desiccated that it is taking up this stain that we've put in the eye. So visually, this person, probably feeling sandy gritty. Their vision is probably declined. They're not comfortable. And like I said, their vision is declined. So you're looking through a pitted window instead of a smooth window. Another main finding that we find behind our microscope is meibomian gland dysfunction. We call that MGD. And these are the meibomian glands that are secreting that oil layer for your tear film, the outer layer. And so what we're seeing here is the kind of that end of the gland. Those glands are vertically in that eyelid, and that is the exit of where that oil should be coming out. So what I typically like to say is that the eye should be producing a nice oil that comes out of that surface. And when the eye is dry, it's more like a butter. So you can kind of appreciate that kind of buttery, bumpy appearance on that eyelid. Now, sometimes I'll see a little bit of that, and if I give a little bit of push to it, it comes out, and so just a little bit clogged. But most of the time what we find is that it's clogged beyond the surface, and we'll go over that later. The third picture I have there is blepharitis, and I like to kind of associate that kind of synonymous with almost like an ocular dandruff. So the eyelids have reduced oils, and that oil has become butter-like, and it's starting to stick to the the root of your eyelash. So it's sitting there at the root of the eyelash. As you're blinking, it's getting kind of flaky, and then eventually those flakes are falling into your eye. So that's causing the eyes to feel really kind of bothered, and that foreign body sensation is present. Now in this picture as well, you can kind of see that scaly skin along the border. And so this person's got blepharitis to the point where it's causing the skin to even dry out. And we'll go over some of this later again. So some clinical measurements that we take if you've ever been in our office. The first set of pictures on the left side, phenol red thread, and you can kind of see the thread on that patient's eye, or the Schirmer test is the one on the bottom. So these two are actually measuring your tear production, and this gives us kind of a reading that we can then measure later to see is this number getting better. So on a dry eye, we're going to see the amount of red or the amount of blue on the bottom much decreased. And hopefully as we get that quality of tear better, the production would be more. The middle one is called inflammatory. Inflammatory is measuring inflammatory factors within your tear film. So it does look very similar to a pregnancy test, but it works about the same way as well, where we're testing the tear film and testing it for those inflammatory markers. And when those inflammatory markers are present, it comes up as a positive. So that test there is a positive test. This is testing for those inflammatory factors. If you have Sjogren's, it's also testing for that. The third test on the right is called the tear osmolarity. We call that the tear lab. And that is testing the amount of particles within your tears at the microscopic level. So if your tear osmolarity is higher, or if the difference between the two eyes is greater between each other, usually around an 8, then it gives us a reading of how dry the eyes are. And this I found to just be a good visual to say, you know, a study of 50 and 50 patients isn't a lot, but what things could possibly be present if it's not dry eye? And so these are some technical terms, but the first one, the blue one, a lot of, 24% is telling me that it's allergy. So the eyes might feel dry and they're going to be irritated, but it's not really dry. It's kind of that allergy presence that's going to make the eye feel that way. And it mentions the blepharitis. EBMD, epithelial basement membrane dystrophy, is a dystrophy of the front surface of your eyes, and that's more kind of a disease process than dryness. Again, it's going to lead to very similar symptoms, but it's more kind of a disease than a dry eye. The keratoneuralgia, that's kind of a fancy term. Basically, the innervation of the front surface is being affected, again, leading to the same symptoms, but the process of why it's happening is a lot different. Contact lens intolerance, conjunctival chalasis, which just means the front clear layer that covers the white part of your eye, called the conjunctiva, can be excess and kind of lay on the bottom surface. And that usually happens when we age. So no matter what we do as far as dry eye, if you have conjunctival chalasis, the tears are being produced, even if it's normal. And the best, easiest way for those tears to come out of the eye is over the side. And so that's not really because they're dry, it's more kind of an anatomy, just excess skin in a way. Computer vision syndrome, trichiasis means that the eyelashes are poking inwards. So again, foreign body sensation, but because there is a foreign body. And then sometimes it comes out better because we're treating you. So I said we'd come back to this, but we use 3 different stains when looking at the surface of your eyes. The main one that we typically use is called fluorescein sodium, and then we change our light to be blue. It's called a cobalt blue. So what that is showing us is typically something on the clear corneal window part of your eye. And so in the picture there, if you can appreciate it, in picture A, we've put the fluorescein in, you've blinked a few times, and you can kind of see it kind of coating the front surface of your eyes. When we look down at picture D, that punctate keratitis that I had mentioned previously is present. So that sandpaper appearance. So it very well highlights the status of the cornea. The lissamine green and the Bengal red are 2 other stains that we have in our pocket. They're more precise to the clear surface over the white part, called your bulbar conjunctiva. And what that is showing us is, instead of the cornea being dry, how dry is the actual, skin around the eye. And so in A, not much green is present, but down on the bottom, you can see that green being taken up. Or over on the last the last picture, the Bengal red, the red down here, over the white part shows us how desiccated that surface is. So fluorescein is great for the cornea. The lissamine green and the Bengal red are really good for the conjunctiva. So what can we do to help with dry eye? Well, if you're dry, let's increase the amount of water that you're taking. And we all love coffee, but if we could decrease the amount of caffeine that we're intaking and increase that water intake, that's really going to help. Frequent breaks from the computer. We can either decrease our contact lens wear, or we can change the type that we're wearing. So if we're in a monthly contact, our better bet is to maybe try a daily. Think about the environment. Are we sitting in front of a fan? Is the heat blowing in our face? What's the humidity like? I ask a lot of people, especially nurses, where do you work? If it's the hospital, it's not a great, humidity level, and the eyes are going to feel dry. So those environmental factors really do play into account. We have the option of trying a warm compress. So we're looking at that meibomian gland. That oil is becoming hard like butter. And what's the best way to melt butter back to oil? We add heat. So at our office at Nittany Eye, we do sell what's called a brooder mask. And what's great about these, I recommend them for a lot of people. I love mine, and especially because I end up looking like this model, is that I use it twice a day for 10 minutes. And it's a localized moist heat that you put on the surface. And it's a good moisturized heat that's going to attack those meibomian glands and help melt that oil back to the oil that it needs to be. You have the option of doing, we might say do a warm compress with a warm cloth. It doesn't stay warm for very long. So what's great about these masks is you pop them in the microwave for 20 seconds. They stay nice and warm for 20 minutes. They don't typically scald you. And so we recommend those brooder masks. Of course, many of you, if you're listening to this, have probably suffered from dry eye. You've probably seen the thousands of options that we have with artificial tears at the store. I've listed 6 of the brands that are typically better. So Oasis, Refresh, Sustain, TheraTears, Soothe, and Blink are some great brand options that we have over the counter. Of course, when you go to look at those brands, each of those brands are also going to have subdivisions of each type. So that's why we do recommend coming in to see us, because more than likely, you've got dry eye, you have different types of dryness. Very rarely do we see that you have only one type of dryness, but we're able to at least recommend which subtype of this brand do we recommend for you to take. We do, as a side note, I think most optometrists would agree with me that I tend to stay away from Visine and Clear Eyes. They're great to get the red out, and they're great at advertising, but their mechanism of action isn't the most healthy for the eyes. So Visine and Clear Eyes do have a place, otherwise they wouldn't exist. But when it comes to dry eyes, I do not recommend them. And as another side note, if things are dry, or if you're really just interested in getting the red out, which, that's the advertisement for Visine, there is a newer drop available that's called Lumify. So if you're, say, I'm going to get personal, a mother like me with a 3-year-old and a 7-month-old, sometimes my nights of sleep aren't completely extraordinary. And so a drop of Lumify is going to hide that redness just because I'm exhausted, So. Other treatment options that we have. So along the eyelids, you had that blepharitis, that dandruff. And we need to clean that dandruff off, or otherwise it's falling into the eyes. So the dandruff is present. You've also been inflamed along the eyelid margin. You have some over-the-counter options, which most of these actually are over-the-counter. Easy to find in the store is going to be the OcuSoft down here on the bottom. And I'll recommend this for some mild blepharitis. In our office, we have the Brooder Hygienic Eyelid Cleanser. We typically will recommend, if necessary, the Avenova, that is a prescription. The Blefadex and the Clearadex, they each have their benefits. They are not prescription, but typically hard to find in store. And so we do sell those as well at our office. In addition, if it is mild, sometimes I recommend baby shampoo. It doesn't, cause the eyes to tear, it doesn't burn. And it's a gentle soap to do in the shower. But it has to be pretty mild. Otherwise, sometimes it won't make a dent in the blepharitis that we see on the surface. We recommend taking an omega-3 supplement. Research has shown that the fish oil, at least 2,400 milligrams a day, can increase the quality of the oil produced by your tear film. It also decreases the inflammation present within that tear. In our office, we use the PRN, and specifically, we have it in the soft gel and liquid form. The reason why we recommend the PRN is we feel as our eye community that it is a good quality fish oil available. One downfall of fish oil is that it is a nutraceutical, and most nutraceuticals are not approved by the FDA. And so not a lot of research is done to them because they're over the counter. And at least with PRN, we know as our practice that it is a good quality source, that is a good quality of omega-3, which some over the counters may contain omega-6, which is pro-inflammatory. So we know that PRN is a good omega-3 anti-inflammatory, and that is why we recommend it from our practice. We have some prescription options available as well. Some of you may have seen the commercials for Restasis and Xiidra. Each have their, their benefits. Restasis and Xiidra help produce a good quality tear. Now I do, for my patients that I prescribe these for, the way that they work, or they are actually attacking the immune response within your tears. And so they each have their benefits. Sometimes it does take a little bit for their complete action to take effect. So with Restasis, the cell that it's helping change has a lifespan of 3 months, of 90 days. So a patient may not feel any improvement before that 90 days, but afterwards it starts to do its job. Most of the time we're feeling better before the 90 days, but sometimes it takes some time to get there. Other options that we have, some mild corticosteroids. So there are many options available. I included Lotemax, which is an off-label, but has been proven to be a good one for dry eye. And in addition, doxycycline is a antibiotic, a tetracycline, but it is also shown to help, based upon the meibomian aspect of your tears, help with dry eye. In office, we also have Mibo and Blefex. If you're a patient of ours and you've had this treatment, you might have one or the other, or we can combine both. So looking at those pictures that I initially posted on my first slide, on that top one, we've got that meibomian gland dysfunction. That oil is kind of getting that butter appearance. And the Mibo is actually kind of a medical grade compress. So we use an ultrasound oil on the eyelid, and we use this nice warm paddle as kind of an eye spa. And it's more of a localized heat to attack those meibomian glands. Down on the bottom, the blepharitis, we have Blefex. So Blefex is kind of a vibrating tip that will is kind of localized along that eyelid margin, and it kind of rotates and kind of gets rid of all that debris that likes to sit at that base of the eyelid. Sometimes that debris is so tacky that we need this medical grade kind of Dremel to get that debris off. That sounds awful, but it actually is really good. So sometimes it's best to connect Mibo with Blefex, where we heat it up and then we get rid of all the stuff that sits there. Additionally, some other treatments, if we've gotten the tear film to be of good quality, but we're either not producing enough or we're draining too quickly, we can insert a punctal plug. That's the picture on the left. So the drainage, it goes down the puncta into the nose. So if we occlude that puncta with a punctal plug, it decreases the amount that's being drained. And typically you can either do a collagen one that breaks down to see if it's an option that will work. And then if so, we can always put a punctal plug in that remains there until we take it out, or if you accidentally scratch it out. In the middle, an amniotic graft membrane. In our office, we typically use an amniotic membrane called a Procara. An amniotic membrane is actually a membrane that comes from the placenta of a human. So the placenta contains stem cells. The stem cell can become any type of cell in your body. So as we place this membrane on the front surface, it allows the eye to heal in a natural way. It's using the body's own response. And so only recently have we found the benefits of using an amniotic membrane for dry eye. What recent research is showing is not only is there benefit, but as it's placed on that eye, usually for a period of 3 to 5 days, after we remove it, the benefit continues for up to 3 months. The third, a scleral lens. Our associate doctor, Dr. Abby Harsh, is our contact lens doctor. And a scleral lens is a larger, harder lens. and it will increase the amount of tear available to the front surface. So sometimes if we're not able to do a soft contact, a scleral lens could always be an option for you as well. And something I mentioned previously, if you are a contact lens wearer and you're in a monthly, we do recommend trying dailies. A fresh pair every day tends to help the dry eye. So things to consider to prevent dry eye from occurring. Be aware of your environment, wind, heat, humidity, and like I mentioned, perfumes, laundry detergents, those kinds of things. Decrease your screen time and take frequent breaks, which during COVID, I'm sure is very easy. Add moisture to the air, humidifiers. Wear wraparound sunglasses and other protective eyewear when you're outside. Avoid smoking, using artificial tears, decreasing the amount that you're wearing the contact, or as I mentioned, change to a daily. Review your medication list with your primary care doctor if you're to the point where the dryness is causing you to go crazy. Control the systemic diseases with your primary care doctor. And the easiest one, of course, would be to stop getting older. So I hope that was a helpful presentation. Please let me know if you have any questions. Thanks, everybody. Have a good night.